Hello, I'm Dr. Valinsky. I'm a director of Chemotherapy Center, and this is Natalia Rowe, our best and the brightest speech and feeding pathologist. And today we're going to be discussing the questions that I actually been asked pretty frequently about the normative milestones in regards to feeding process. So I guess I would start because basically I'm frequently asked to evaluate very, very young children, infants, in fact, in terms of their developmental milestones. And feeding is one of the milestones that we pay attention to. Generally speaking, how normal process of feeding occurs is that no matter whether the child consumes bottle or the child is being breastfed, at some points between the 4 to 6 months of age, the child starts to be interested in solids. And the best way to start the feeding process is actually put the child on your lap and see if the child is interested in the foods that you are eating. And quite frequently, because at this age, the child already has a relatively decent level of hand eye coordination, the child will try to grasp the food that you're eating. The child would demonstrate their interest in food. The child would try to grasp your utensils, and you will see the child is actually able to start solids. Now, in terms of the type of solids to start the child on, it's a debatable matter because there are some theories that say that it's better to use pureed food, and there are also parents who prefer to use just like lightly mashed or even some solids that are easy to consume for a child from the general table, from the adult table. I'm not going to address this question here, except that to say that between the ages of 6 to 9 months, we would like to actually introduce solids, and we would like for the child to be able to nibble, to swallow, and to put at least some amount of food in their mouths on their own. Uh, about, I would say, that same age, between 9 months and maybe 11 months, the child also starts to be interested not only just in food, but also in your utensils. So it is absolutely possible to put a little spoon in the child's hand, and the child will try, usually unsuccessfully, to use the spoon to feed themselves. But basically, by I would say by 12 months, you would want to see the child who is being spoon fed by an adult and is able to use efficient swallowing and some level of chewing. And when it comes to chewing, it is very important to see if the child is able to transport the food from the front of the mouth to the back of the mouth, from side to side. Of course, there will be some trial and error, and the child would spit some out, the child would swallow some, the child may sometimes even have a hard time, and they would be coughing occasionally. But all in all, you want to see a certain level of proficiency in terms of getting the food to their mouths, partial on their own, not full on their own, but at least partial on their own. You want to observe an avid interest in this process. You want your child to be interested in food. And you also see pretty competent swallowing process and a good amount of chewing, no matter the number of teeth. Teeth, I have to say, some parents ask me whether a child has to have a full mouth of teeth to be a good eater. Not at all. Children tend to chew very, very well with their gums, so it's not an issue. Number of teeth in the mouth is not an issue at all. It's not. What matters is the ability, the motor ability of the child to move the food from the front to the back of the mouth, chew on it, to swallow it. And what matters, again, the most is a good interest in food and certain ability in hand-eye coordination, wanting to use to either feed themselves with their hand or to use some utensils. So, and there are, of course, extremes, like occasional I see children who are fully feeding themselves at 12 months pretty successfully with relatively small amount of mass, and sometimes you see a 2-year-old who is not using any utensils and who are feeding themselves fully with their hands. In my opinion, no matter what they use, as long as they're feeding themselves more or less and they're chewing, they're swallowing, they're okay. Now, I'm gonna give Natasha space and time to explain when it's not okay, what type of symptoms to look for that would be signs for us to involve a professional in the process.
Irina, thank you for the overview of a typical development of feeding skills. Having said that, uh, things don't always go according to the plan. And quite often, we would see a child who, at a particular age, when we expect particular feeding skill, is not showing those skills. Now, the question there is it still part of the normal range, and is the child going to outgrow it, or is it an issue and should it be addressed in therapy? And this is not a straightforward question. We do need to look at a variety of factors. So what we look at is three areas of skills: sensory, motor, and behavioral as well. So when a young child begins to eat, like Irina said, around the age of 4 to 6 months, there is a reason why children transition from the bottle to purees or solid food around that age. This is when certain anatomical changes happen that make the process of swallowing in an upright position safe. And we also need to consider whether or not the child is able to sit up at that age, because children do tend to sit on their own by 6 months of age. So if this is not happening because of some physical development reasons, feeding in an upright position may not be a safe experience, and the child may miss the sensitive period for development of a particular set of skills. When it comes to, as Irina mentioned, the controversy around should we start with purees or should we start with solid foods? If we don't start with solid foods and start with purees, will it mess up my child's feeding skills development? In my experience, if a child has no feeding issues and no predisposition for to develop a feeding disorder, it's not going to make a difference. The baby-led weaning program works perfectly for healthy babies. However, I constantly hear from parents of children with feeding disorders that they tried these magic programs, including baby-led weaning, and it's not working for their child. There's a reason for that, why it's not. And the reasons can be anatomy, it can be related to physiology, can be related to the child's sensory and motor status. What's sensory? What do we mean by that? It means that for one reason or the other, this child presents with higher levels of sensitivity to particular tastes, textures, flavors, and in severe cases, even the color of food and containers in which the food comes. We had this young lady who was about 18 months old, who refused everything, and we couldn't find a pattern until I noticed that she was picking red objects in her environment. So we just tried to color, use a food dye to color her cottage cheese, yogurt, and something else red, and she accepted those immediately.
Oh,
So you never
interesting.
know. Sensory system is an interesting thing, and children may develop sensitivities as a result of medical issues such as GERD, gastroesophageal reflux disease, or severe allergies, or some other type of unpleasant early medical experiences. Later on, sensory issues translate into motor issues because since a child is not being exposed to particular textures and flavors, mostly textures, the child is not transitioning to manipulating the food in the mouth in a mature way, to chewing. And chewing initially starts and is aided by a reflex that has not been fully integrated yet, like the phasic bite reflex. Unfortunately, if a child is unable to try and have experience with solid foods, or is introduced to those foods much later when the reflex has already integrated, the child has missed the window of opportunity to develop those skills easier. And now we need to teach those skills. Having said that, mature chewing skills develop over the first up to 6 years of life, and they include diagonal and rotary chewing. So there's a lot of fine tuning that needs to happen there. But the basic foundational chewing skills begin around 6 months of age. I would like to mention the behavioral piece as well. Child or not, when we have some negative experiences associated with a particular situation, we tend to not want to be in that situation, and we tend to look for ways to escape that situation. So, for a young child, what are some most common communicative strategies they can use? They can cry. They can say, I don't want to be here if they talk, right? If they can't talk, they will cry, and you still don't let them out. They will tantrum, they will push, they will throw, they will kick and hit. If they have gastroesophageal reflux disease and they have that bolus going up and down their esophagus, so it's easy for them to vomit, eventually they start engaging in behavioral vomiting. If once it happens, mommy takes the child out of the feeding chair and transitions the child to the bathroom to wash him before continuing with feeding. That break is enough usually for the child to know, okay, I was successful. It worked. It stopped. Uh, so these are possible areas where we might see feeding difficulties in children, or it might be a combination of them. How do we decide if this issue is pervasive and a therapy is indicated, or whether the child is going to outgrow? The intensity, the combination of these symptoms, and also how that affects child's weight. First of all, we want to make sure that the child is getting appropriate calories. Child's social life. If a child is unable to eat cake for his birthday, if a child is unable to eat pizza at a friend's party, that might start impacting the child's social emotional development. And how does that affect the family dynamics? We quite often hear that a family has not been on vacation for the past 6 years because the child eats one type of puree that mommy can cook at home, but they cannot go on vacation because they're scared that he will not eat anything.
I would also add here is that I think the level of the child's physical activity is important. And what I've observed in underfed children is that they become relatively lethargic.
True.
Children absolutely need to move in order to continue their development. So I would also add this child being a little bit too quiet, a little bit too lethargic as one of the signs that therapy is needed.
This is correct. So I'm part of mommy's groups on Facebook, and quite often I see questions about feeding. How do I get my child to eat this? And there are some pretty interesting strategies, including creative cooking, how you organize food on that plate, and sometimes they work. Whenever they work, I know this child is probably not a candidate for feeding therapy. This is just a regular picky eater, a developmental picky eater, so it's probably okay. But I think it's important for parents to understand that you might have three children sitting in a row who look more or less the same and they show more or less the same symptoms, but only a professional can tell whether or not it's a feeding disorder that's going to linger or it's just a phase that's going to go away on its own. So if you have concerns about your child not eating appropriate foods at an appropriate age, the best course of action is to consult with a specialist rather than with other mommies on the playground because they might have had a totally different experience.
I would very much agree with you, and I think it would also prevent many issues later on because right now we have a good number of older children in our clinic who need lots of behavioral help with their restrictive type of eating later on in their preteen and teen years, where those issues are much more difficult to address because the child now has a lifelong experience of having a very complicated relationship with food, and it affected negatively also their relation with their body.
Thank you, Irina.
Thank you. Thank you, Natalia.